Sponsoring the webinar is Equilox. From repairing small quarter cracks to reconstructing an entire hoof wall, Equilox adhesive and its trade secret technology for better bonding is the farrier's best tool for the job when compared to the other most commonly used product. Learn more at equilox.com. So with that, let's begin the webinar. Stuart, thanks for joining us, and take it away.
Thank you. Thank you for the introduction. I'd also like to thank the American Farriers Journal, any company that's helping push our industry forward as tradesmen and professionals. We certainly need to get behind them and support them, so I'd like to thank them for that. I'd also like to thank Equilox for sponsoring. They do a great job. They've got a great product. I think this is a very relevant subject at this time of year. In the bluegrass here in Kentucky, we see a lot of rainfall with humidity and also high temperatures. So mechanical failure of the horse's wall and sole is something that we're going to see a lot. What influences those changes? Like I say, is the seasonal changes, the weather. That'll be regional to where you are. I know in the southern hemisphere, the winters, and possibly Ireland as well. That is your most wet time of year, but like I say, in the bluegrass here, right now is the time we're starting to see trouble with horses' feet. So like I've already said, humidity levels are going to increase. Hoof hydration or saturation levels also increase at this time of year, and therefore hoof deformation is also going to start happening. Loading and unrollment changes is also an issue that we're going to see. The higher saturated these feet get, the distortions are going to come a lot quicker and sooner to those feet. And as the loading changes, it's an ideal environment for bacteria and also fungus to set up in the horse's feet, and that's what we see a lot. And therefore also the incidence of lameness becomes significantly higher. Hoof distortions are caused through loading or overloading of the weight-bearing structures. Excessively stressed hooves have a tendency to allow bacteria or fungus into the foot. Wall and sole thickness is fundamental to the strain that wall and sole will stand before any deformation takes place. A wet environment softens the structures, enabling distortion, keratinophilic diseases to enter the foot. Trimming protocol may need adjusting seasonally to maintain soundness. And that's one thing I really want to touch on, is that last line there. It's very easy for farriers to become almost one-dimensional, if you will, in their trim. We're taught in a very systematic way how to shoe a horse, and I think if we can pull together lots of different ways of trimming a foot and bring it all together and be very individual about the foot we're trimming, I think it will certainly help us push forward. So typical distortions or conditions that are associated with wet feet, I'm going to go over these subjects more in depth as we go. Flares. Solar prolapse is one that I really do keep a very close eye on at this time of year. Abscesses, bruise, delamination of the stratum or wall, thin sole, weak shelly walls is something we see a lot. Thrush of the frog, white line, and seedy toe or onychomycosis. What I try to do is I try to set the foot up in the dry season. So you've got to get to know the foot a little bit. So it's not something you can just roll in your first time or two with a new horse and kind of, work along with. You've got to get to know these horses to be able to set these feet up. I've got horses in Michigan that go through to Wellington in Florida during the winter months, and my whole process during the summer months is to set them up for that humidity down there. I want to increase foot integrity during those dry months to set them up for the wet months. So I've got enough foot to last me through that wet season. So essentially it's pragmatic shoeing. I want to be more practical. The theory still has to be there, but I really want to be looking out for any changes that I'm seeing and setting that horse up. So basically set the horse up for the following months. To do that, I need to load the strong areas of the hoof and support the weak. So I think hoof mechanics during locomotion definitely change. Professor Jeff Thomason has done some fantastic research into the phases of landing. The first phase is the only phase of concussion. The second phase, sliding and stopping. Third phase is when the hoof capsule is under complete load. I'm going to break this down further and put the first 3 phases into one bracket and the last phase into another one, because as farriers, that is the 2 phases I think we can influence the most. Here's a video of Jeff Thomason's, and we can see the coffin joint being depressed down into the hoof capsule. The quarters are flaring out, and I think these are exacerbated when there's a higher saturation level in the horse's foot. I think this computer diagram here is really showing your first 3 phases of landing, your concussion phase, your slide and stop, and also when the foot is under full load. I think things change a little bit when we go to 4th stance or 4th phase. I think at that point the dorsal wall becomes under a lot of strain. So as the coffin bone gets elevated up in the hoof capsule, we're actually seeing a lot of stress on the dorsal wall. And if we think about the feet that we see during the wet months, normally the dorsal flaring or infection in the white line in the dorsal area of the foot is one of the most common we deal with. Now, of course, horses don't always break over straight on the dorsal wall. We'd be expecting perfect conformation if they did. Conformation plays a huge role in what we see. If the horse was carpal varus or carpal valgus, or in or out at the knee, of course that's going to change where they load. So some horses are going to break over in the lateral or possibly medial quarters. So we need to be observant of that as well. Trimming. What I try to do is identify the individual foot architecture. Some horses will have nearly 2 or 3 different feet depending on which diagonal they're most heavy on. But basically what I'm looking for is balance, the solar contour, if there's any flaring in any direction. And this is every time I look at a foot. Every time I turn up to the horse, I think to myself, what has changed since the last time I set this foot up? Just because I've had this horse sound for 6 months or a year, the way I've had it set up, that doesn't mean to say that's the way the horse needs to stay. I need to be very active and proactive about my shoeing prescriptions that I'm issuing this horse. So distortions, I'm also going to look at wall and sole health. I want to know how healthy are those tissues. I know that, especially with frog health, if I've got a healthy frog, I've also got a healthy digital cushion. If I've got a healthy digital cushion, I know that this horse is going to be dissipating weight quite evenly throughout the foot. I'm also looking for any areas of the foot that are not coping well with the load they're carrying, and then I can start to shuffle things around. So traditionally we're taught to dress the feet and it's a very cosmetic job that we're taught to do, and it certainly is an important part of the job, but we've also got to be mindful that the more foot we take away, we're also weakening the hoof capsule. So I think Rick Redden has coined the phrase that hoof mass will outweigh hoof balance. So I think it's important to take that into consideration, and we can certainly change our trim around and manipulate things a little bit to help to leave more foot mass behind. I still like to shoe around the center of articulation with these horses. It's my go-to. It's one of, I've essentially got 4 or 5 things that I like to take into consideration when I'm shoeing a horse, and certainly shoeing around the center of articulation is one of them. And what I'm looking at there is having equal amounts anterior and posterior of the coffin joint. I'm also looking at a foot, when I pick it up from the sole of the surface, I'm looking at the elevation from what would be the terminal arch to the dorsal or medial-lateral border. When I'm trimming a foot, I like to almost imagine that I'm superimposing a coffin bone in under the sole. So I don't want to flatten out the sole and leave no sole there. So I'm looking at the amount of elevation. Now, if I could measure, and of course every coffin bone architecture is a little bit different, normally from the terminal arch to the dorsal border, there's around about a 15 millimeter vertical rise. So if I peel back the apex or the live junction of the frog, I can measure these distances visually, and that'll help me get the idea of superimposing this coffin bone in under the sole, what I'm seeing. So we can see here on the picture on the left-hand side, there's not a lot of elevation out of there. It's a reasonably flat foot. I've certainly seen flatter. The picture on the right-hand side, we can see a lot of vertical depth in this foot. So I know that I can get through that foot, and there's also a lot of foot mass. So I'm going to be careful about how I get around both these different feet, but both these different feet are also going to have different shoeing prescriptions. Here's a sole that I like the idea of. I can almost imagine that coffin bone sitting underneath there, so I'd be fairly happy if I saw this foot. I always try to cross-reference my work. So although when I'm balancing mediolaterally along the long line of the leg or at a T-section off the cannon bone, I like to cross-reference my work and put as many pieces of the puzzle together as I possibly can. So if I look down into the frog collateral grooves, that is a stationary landmark that's not going to move. So we can see this horse here is actually a little high on the left-hand side. If we get down to the bottom junction of those collateral grooves and take the same measurement up to the coffin joint, that won't move. That is a static junction that I can always look to, and that's going to help me achieve mediolateral balance if I was ever in doubt due to conformation. So when I look at these feet, I'm always analysing what is weak. This is a thoroughbred horse right here. We can see that these feet are going to have a tendency to want to flare dorsally. So to leave as much foot mass behind, this horse was left barefoot, I'm really not going to touch those exterior walls at all. I'm just going to round them up from the bottom and leave as much foot mass in place as possible. Sometimes if I see a wall that's overloaded, I think to myself, where else can I push the weight? What other structures can I incorporate into this to help spread the load over a greater region? So sometimes if I think back and we go back a few slides to reading the elevation of the apex of the frog to the dorsal border, if I can read that elevation, I don't actually have to take out the callus sole in this horse's foot anymore. I can leave all that in to leave a lot more foot mass in place. So traditionally we're taught to take that out and it's going to help us balance the horse's foot. But if we can reference other landmarks, we can push on and actually leave other structures to help unload other structures. Hoof deformation. There's numerous things that we're going to see. Mike Savoldi has done a lot of nice work on reading the sole area and how healthy the sole is, and he tries to allow us to figure out what it looks like underneath. So here's a horse that I saw just last week actually, and it was sound on hard ground but lame on soft ground, and I saw this little area there in the toe, and with hoof testers it was quite sore. So we've got to think about when we see these little blemishes in the sole, exactly what it looks like underneath. So here's a horse that was shed heel, so we can actually see some solicorium damage on this horse's foot. So Mike Savoldi gets also into the idea of that not only can we have mediolateral imbalance, but we could also have a quadrant imbalance, and I think that's what this picture's showing. Thin sole is another one. Like I say, I like to get these horses' feet as strong as possible during the summer months, during the winter months. And therefore, what we can find sometimes, we will lose a little bit of sole when the rain starts. The reason for that is I think they get overly hydrated, and sometimes they'll just exfoliate out the sole that we've had. This horse here, you could actually feel radiating heat through the sole. That's how little she had. She would yield to thumb pressure. Again, she was sound on hard ground and lame on soft ground, and that's just the ground force reaction of the dirt pushing up onto that solar region. So for this horse here, I actually put her into some Sigafu shoes, Series 2s, and that helps me deflect some of the ground force reaction. She was nearly immediately more comfortable. Thrush and the central sulcus of the frog is something that we see a lot. It's a perfect little area that it's nice and soft and easy for bacteria to sit in there. Typically with these, I like to pare away the frog and try to get back to some healthy tissue, so when I do medicate it, I'm getting good penetration into the areas. Sometimes you'll see a deep crack into the commissure. When I see this, it really does concern me. It concerns me the damage, how far down the damage is within the frog's sulcus. So I've got to come up with a way to medicate these horses. These are some pictures courtesy of Anatomy of the Equine, Jenny Edwards and Paige Ross. They've done some fantastic pictures on internal structures in the foot and also external. We can see there on the left a really healthy frog state. On the right hand side, they've actually put a hoof pick through down the central sulcus, and we can see how much damage is actually being done by thrush. So once again, what we see from the exterior, we've got to come up with some sort of idea about what's going on the inside and see how serious it is. So for these horses, a topical treatment is always a really good idea, but the trouble with that is if we do put a topical treatment on these horses, 9 out of 10 of them are going to go back out into the paddock and just wipe it all straight off. So for these ones, what I like to do is get a high concentration by hoof packing some sort of topical solution on. In this case, it's Kevin Bacon product. So with the hoof pack, I'll just saturate some gauze. I'll also paint the frog, wrap it in either vet wrap or elasticon, and then duct tape over the top. The duct tape's going to help any water stay out. Wall separation and delamination. I like to look at the wall and see how healthy it is. We can see some little blemishes in the wall here where there's just a little bit of flaring through the quarters. The central sulcus of the frog doesn't look too bad, but I think I'd still treat that. And for these ones, I'd have a tendency, if the horse was to stay barefoot, to hijack the barefoot trim. And so, like I said earlier, it's about not being one-dimensional and pulling in as many elements as of many different trims that suit me. So you can see here, just by rounding up the bottom of that horse's foot, most of those little cracks and blemishes are already unloaded. Sometimes they can go deeper. I'm always very cautious about removing too much horn. It's a little bit like white line. I don't really want to push the horse into any sort of rotational kind of idea with the coffin bone. So what I'll do here is I'll normally get out a very small curette and I'll dig out these grooves the best I can. And then once I'm fairly confident that I've got them nice and clean, I'll normally pack them off with like a Keramine paste or a copper sulfate paste. And I'll generally hoof back over the top and get the owners to do that as well, like on a daily basis. Weak or shelly walls is something we see a lot at this time of year, and I think that comes from the delamination of the stratum. Possibly a bacteria or a fungus is getting into the wall and just harboring in there. And so we're not getting a really strong wall, and it's very easy when we rasp these feet, they tend to just kind of flake away. But when I interpret this foot here, what I'm looking at is, if I was to look at the strongest structure of this horse's foot, what I'm seeing is the toe region and also the frog. So this is a perfect candidate for some either sole support in the way of a heart bar shoe, maybe some Equipack, but I'd certainly be looking to unload that heel region. Load sharing is an interesting one. For a long time we believed that we couldn't put any weight on the sole at all, and I think that's one of the bigger breakthroughs we've had in the last few years. But when we think about a deformable substrate underneath the horse's foot, like an arena, we know horses go really well in an arena setting with deeper footing. So it's fair to say that the sole does load. So what really matters is how we're loading the sole. When we think about a barefooted horse, the wall takes most of the load. The frog may take some load, but that was also going to depend on the frog health. When we put the horse onto a rim shoe, typically 100% of the weight then is supported on the exterior of the horse's foot or the wall. So we're changing loading capacity just by putting a shoe on. So at this point here, normally I try to use as low a profile shoe as I can and keep the frog as close as I can to the ground and load as many structures. Of course, when we start to think about a heart bar shoe, we can start load sharing. So we can incorporate the frog into the shoeing prescription. So if I've got a wall problem, a blemish in the wall, some sort of seedy toe or white line, I'm going to be looking to offload those structures somewhere else. So the idea here is, instead of having a 100% load on the exterior wall, I'm incorporating the frog and load sharing. So it'd be, say we use some percentages, instead of having 100% on the exterior wall, we've now got, say, 30% on the frog, therefore we're allowing 30% of the pressure off that exterior wall. Here's a classic case of when I would start to think about load sharing, certainly onto the frog. We can see in the left-hand side picture there that we've got some separation happening in the quarters. These are all things that I'm starting to look for. I've got to have that identification process down. I'm looking at wall health. So what I'm looking at here is, even though this doesn't look that bad, I'm looking to be more proactive than reactive. I want to get ahead of the game, especially if we're looking at horses that are competing at a high level. I know that if I've had horses going down to Wellington in Florida, that they certainly don't want to have any problems down there. So I want to have all these problems under control before I get there. So from there, I'd still be looking to, we can see those heels are also kind of migrating forwards. The heel health and wool looks okay, but they're certainly looking to migrate forwards. So this is a fantastic idea to pack it off with Kiramen paste and also transfer some weight onto the frog. Equipack's another one. Being in the wetter months of the year, I'll quite often cut out the frog region of the Equipack. I do that by putting a full paw and then cutting it out. I'll heat up a sharp knife with my propane torch. I suggest you don't breathe in the gas. It's not very good for you, but and this will allow me to give sole support, load shear onto the sole, but also, if I needed to, treat the frog. Sometimes if for whatever reason the horse can't go into a heart bar shoe, we've got to start looking at other shoe options. On the left-hand side there, you'll see a modification that I've put onto the shoe. It's called a French roll. And essentially what I've done is I've inverted the inside branch down further and created a roll into the shoe. And that's going to move the weight more axially across the frog. So that can be another little thing that we can do. Prolapsed Frog is going to tell me a lot about sole health. And essentially, the higher we elevate the frog off the ground, the more the frog is still going to want to find the ground surface. So I thought this was a great picture of, and kind of really shows exactly what I'm talking about here on these big jar corks and cork heels. We can actually see the center of that foot actually caving in through the center of the shoe. So elevation or vertical height of the shoe, or stock of the shoe, is something I'm very cautious about. Here's another short video from Jeff Thomason. And this just shows how much kind of solar prolapse we could have. If we're looking into the center of the picture there, we can see exactly how much pressure in this computer-generated model, how much flexion we get out of the sole. So the higher saturation levels, we're going to get far more depression in that solar region, and that's going to certainly help push those frogs further down. Here's a classic case. This horse is in some really thick, wide web aluminum shoes, and we can see that the frog has certainly made its way to the ground. What I did with this horse is I put it into just some Equipack, and I could actually slowly see that frog retract its way back up into the foot and be in a better state. So when I'm looking at how much frog prolapse I've got, it's a measurement that I could take from the buttress of the heel to the very top of the frog that I'm seeing. Here's another classic case. You'd have to be careful with this horse here. The reason for that is with that much prolapse, if we were to put a heart bar shoe on, remembering that there's 3 different heart bar pressures. There's negative pressure where the heart bar is not touching the foot at all. Neutral pressure where you're just laying the heart bar onto the frog. So if that solar region was to kind of come down and to press onto it, it's almost like a hammock just catching it. And then also positive pressure. Now a horse like this wouldn't stand positive pressure very well, because with that much pressure on the frog, you're probably going to get some sort of necrotic tissue setting up and just too much pressure on that frog. So with this horse here, I probably would put it into a rim shoe, pull with Equipack, and just be very gentle about trying to get that frog into a better situation. Here's a horse here. This is what is a clubfoot. We can see here that the frog is not only prolapsed, but also the whole solar contour now is convex. So this horse here is definitely one that we'd need to give some solar support to. Compressed growth rings is something I'm also very cautious about. I think they're going to tell us a lot of information about this foot. This horse here had really bad cellulitis on the left hind limb. We can see that new growth coming down. Even in that new growth, the cellulitis was so bad that I actually had to put a 6-degree wedge on this horse's foot just to get her load bearing in the heel region. But you can see the older growth, certainly the compressed growth rings at the heel get tighter and tighter and tighter. So that tells me vascularly the horse is shutting down in that heel region. And it can also happen in the anterior region of the foot as well, and very typically seen with club feet. So what I'm looking at is if ideally those growth rings would be nice and even. Seedy toe or toe cracks is something I'm going to be very cautious about watching. And this here is essentially mechanical failure of the wool. where the load on the wall was just being too much, and essentially the foot is just crushing under the effect of during the fourth phase. So I mean, there's no two ways about it. There's also a certain amount of neglect in this case. The interesting thing is, here's a foot that we dissected. From the exterior, you really never know how far that seedy toe can run up the inside of a toe crack. Very cautious in the wet months about removing too much wall and creating too much instability in the foot. So with these horses here, typically I'd use some Keratex hoof hardener. I'd clean out that area the best I could from the solar surface with my curette, which is a very, very small kind of cupping knife that I have. And I'd clean it out the best I could. I'd pour Keratex hoof hardener probably into it. And then I'd also get some cotton wool. I'd saturate that in the Keratex and I'd push it up in there. And the reason for that is I'm going to get passive treatment for the next 2 to 3 weeks until I come and see this horse again. And the other thing is it's also going to deflect the ground from pushing up into there again. So you can also do that underneath the shoe, which I found very effective. If I do believe that the crack is unstable, we've got to do something about it. Typically, I won't stitch these cracks together. I don't think pulling the wall together at the dorsal wall was what we need to do. I think actually put quite the opposite. I think we need to push the wall away from each other. So what I'll do is I'll set this horse up with some Equilocks and an aluminum toe plate. The plate actually underneath that glue will have holes drilled through it to help hold the plate in place. If I was to dig into the crack a little bit, I'd make sure that was medicated. You can see there I've used some copper sulfate Keramine paste. I'd also tape off the hairline. I don't want the glue anywhere else. I'd be very, very intentional about where I want the glue. And then when I was ready to put the toe plate in place, I'd actually unload the foot. I'd put it up onto my hoof jack or hold it up, suspend it up in the air, and make sure that foot was unloaded and hold it up there until that glue was fully cured. The picture on the right-hand side, you can see that they can kind of look nice. This horse also had a glue-on shoe, and a lot of that, the reason for that was because the wall quality was so poor. So really, the wall was just being compromised the whole way. These little bacterial tracks that we can see in the hoof wall, here's a pony that I was working on, rotated pretty heavily, sunk slightly medially as well, and so the white line gets very stretched. And it's a perfect area for these little bacterial tracks to set up in. So when I see this, this is a precursor to possible abscesses and all that other kind of nasty stuff. So I'm very proactive when I see this. And typically what I'll do is I'll use clean tracks for that. I find that if I use clean tracks, it really does get those feet clean. It also soaks up into those little crevices that really I don't want to get in there with my knife and rip the horse's feet to bits. Once again, I'm trying to leave as much foot behind and set it up for these wet months. So what I'll typically do with clean tracks is one of the little bottles goes into a gallon of water. I split that off, put half a gallon on each foot, and I'll soak them for 40 minutes in an IV bag. While I'm doing this, I'll typically go on with another horse. After the 40 minutes is up, I'll actually puncture holes in those bags and let them vaporize for another 40 minutes. The gases that it lets off also help kill the bacteria and fungus sitting in the wall there. After that, what I'll normally do then is I will hoof pack these feet for 2 to 3 days. I'll come back and check on them, make sure all those little crevices are nice and dry and in a position where I'm comfortable to go ahead and either nail on or glue on some shoes afterwards. Abscesses is something we see a lot at this time of year. It's a perfect breeding ground for, with the horse's feet being so porous, to soak up a lot of water. With that water could go, there could be some bacteria sitting in there. It goes into the white line. I think there's numerous ways for a horse to get an abscess. It could be demineralized bone, but with the heat and the water and the humidity, it is a perfect breeding ground for bacteria. And this is typically what we see once we locate the sorest spot with hoof testers. We can normally push down with ideally the smallest blade knife or a loop knife possible, like a searching knife, and remove as little sole as we can. By removing as little sole as we can, we're waiting for less of an area to have to epithelialize back in and have that heal over. When we do this, of course, we need to set up a better environment for a healing. So it's not like we can puncture these abscesses. Once again, we have to think from the outside, how far through the sole have I actually gone? If you've reached blood in the process, of course, you're down to the solacarium. And I think for farriers, it's one of the most undertreated aspects of shoeing. This is an ideal case to put a hospital plate on or something like that. A minimum would be to hoof pack this horse and make sure the more dirt doesn't push up into that region. So they're not always as simple as just finding them like that. This horse here, you can see that little blemish on, it was actually the lateral side, I believe it was. Got a small amount of drainage out, thought we had this horse under control, but continued to be lame. So what we actually did was we shot some radiographs, and we can actually see the infection sitting on the coffin bone. So although it's easy, and it can be very easy for a farrier to find an abscess and or essentially look like the hero of the day, if the horse continues to relapse, we need to start thinking about radiographs pretty quick. I got caught this winter myself down in Florida. The abscess drained really easily. I put a leather pad on there, thought I was good. The owner called me 2 or 3 days later. The horse had relapsed again, abscessed again, and the minute we shot a radiograph, it was another classic case of having an infection on the coffin bone. So if these things do start relapsing, radiographs is almost necessary. Sole cracks is another one that we see at this time of year. Essentially, when we go from the frosted hard ground in winter, we can create some solar bruising that comes through, or they'll walk on a hard bit of ground and then their feet soften up. We can get sole cracks. Once again, we need to treat these reasonably serious because we know that a horse with good sole only has 3/8 of an inch or so of sole. So if we see some necrotic tissue sitting down there, we need to be careful about cleaning this out. If I thought it was only in the more epidermal layers, I probably wouldn't be so concerned, but as soon as I think we've got some vertical depth to these cracks or abscesses, I'm very cautious about how I treat them. I certainly don't want to allow an infection onto the coffin bone. So with these, I'll normally wash them out with saline solution. It certainly wouldn't be anything caustic that's going to burn any of the tissue underlaying the sole or frog. From there, for this one here, I nail on the shoe, and then I'd use some impression material to block the area off. I'd then pour it with Equipack, flick out my impression material, and then treat it with some low iodine percentage xenodine or something like that, where I know it's not going to be burning any deeper tissue. From there, I'll put my hospital plate on and then hoof pack over the top. Once again, I'm just trying to seal this horse's foot and make the area as sterile as I can. We do have to be careful with what we do treat the horse's feet with. Copper sulfate is very, very common. I've heard of bleach and numerous other things. This is a horse that comes into the clinic with chemical burn, where you can see the necrotic tissue sitting around the apex of the frog. And that's that black tissue sitting there. So if we use anything caustic on the dermal layers of the foot, we can create a burning. So as we're getting closer, you can see even the extent of the damage. And some people kind of have a mentality of treat them mean, keep them keen kind of scenario where, it'll be good for them. A little bit of burn with bleach won't hurt them, but we're actually setting up a completely different scenario. Here's just a short video of removal of that necrotic tissue sitting from the chemical burn. It actually creates skin across the top of the area. So as it's removed, when this comes out, you can actually see the healthy tissue sitting underneath, but from the exterior, there you go. So you can actually see the true depth after the chemical burn's taken place. So we need to be careful what we're treating these horses' feet with. That foot now looks in a far healthier position to be treated. If I do think the tissue damaged is a little bit more epidermal, a little bit more in the outer layers, or I've already had the healing process take place and the owners or trainers want to get these horses back into work, What I can do is, if I don't think there's going to be any damage caused, is I can just soak some gauze with some xenodine or low percentage iodine. Once again, being very careful not to burn anything on the bottom of these horses' feet. And then I'll pour Equipack Clean over the top. So I just use the gauze or the mesh over the top of the gauze to hold my gauze in place. And I found this very effective. So topical solutions to help wet feet. I do like the Keramine paste by Kinetic Vet. I think it certainly does work. I've seen great improvements, and clients seem to like me putting it on as well. It seems very proactive about actually trying to do something. The trouble with putting a shoe on a foot is quite often you're actually covering up and you haven't got access to these spots that you'd like to medicate. So it seems to stick to the horse's feet that very well. I've gone back for a second shoeing on a lot of horses, and the Keramine paste will still be in place. So I like that. If I'm dealing with really saturated soles and where I think I've got too much movement in the sole region, maybe some solar prolapse or frog prolapse, I'll quite often soak felt pads with Keratex Hoof hardener and then hoof pack that for a few days, and that'll really help kind of dry out those soles. Thrush Buster for frog treatment or Kevin Bacon thrush treatment, I find both of those really, really good. I've already mentioned xenodine for more dermal layers of foot. I think it's one of the safest things we can use, and then Clean Trax for those bacterial tracks. Sometimes when you're backed into a corner, gluing on some shoes is nearly the only option, and it's a safe option. Here's a horse I come across just the other day. Certainly not safe to nail. There's just not enough wall thickness there. So I've got to start thinking outside the square about how I'm going to get this horse functioning and which is the safest way to do it. So we can see, if we think about back to the earlier stages of the webinar, I'm breaking down the solar architecture. I'm looking at the frog. The frog's nice and healthy. There's not a lot of elevation from the apex of the frog to the dorsal border. The whole sole looks reasonably flat. I put my hoof testers on the sole and it's flexing very easily, which tells me I haven't got a lot of foot mass. So for this style of foot, for one, I'm going to try not to be one-dimensional in my trim. I'm going to hijack more of a barefoot trimming method here. So I'm just going to round up the edges. I know that I already haven't got a lot of foot mass, so I'm going to round up the edges and create my balance that way. And then because I haven't got a lot of sole, I'd be very cautious about direct gluing on a glue-on shoe to a very thin-soled horse. I'd be concerned that I could bind the horse's sole up and almost create a sole pressure because I haven't got enough foot mass there. So for that reason, I'd go with an indirect kind of Kevlar-style cuff glue-on shoe. With a little bit of practice, they're very easy to put on. I'll normally use vet wrap up the horse's leg, and that's just to keep everything clean. I'm going to have to pick up, once I've impregnated the cuff with glue, I'm going to have to pick up the leg. My hand's going to be covered in glue, so that allows me to do this with as little mess as possible. There's an easy system when it comes to wrapping these. There's 4 different wrapping styles. Essentially, you can pull the shoe backwards, you can push it forwards, you can shift it mediolaterally, and that's just by hooking the branch and pushing it around the way you want. And when I incorporate the wall and hijack the wall like this, it allows me also to get length of shoe on this foot, which helps me with my balance. Here's another horse that I come to. This one was down in Florida for the winter. This foot was a little contracted in style. Wall quality was diminishing. The sole depth was good though. So I was happy with that. For this one here, because it is kind of contracted, the foot's a little bit elongated, it was a perfect one to try a synthetic glue-on style shoeing. So this is a Polyflex shoe. Typically, I'll use 2 ounces of Equinox with this, and it's very, very easy to do. There certainly is good gluing protocol when we do this. We don't want to have the horse just looking like it's stood in a tub of Equinox. We need to be, you know, as careful and meticulous as with glue on as what we are nailing on. It should be aesthetically pleasing to look at. So good gluing protocol, clean, dry feet. So I'll use a sander and get the wall as clean as I can, right back to the heel. I'll also use a propane torch on the sole and make sure that the soles are as dry as possible. I'll mix some very fine copper sulfate crystals into the glue, and that's going to help keep down bacteria between the external stratum of the wall and also the glue itself. I'd be looking to pack off any old nail holes or any blemishes in the sole that the glue could cover. I don't want the glue to cause an abscess. And then only use as much glue as necessary. I don't want to have any more glue than what I need to. Laminitis is also a hot topic at this time of year. I'm only going to touch on this very briefly because I believe that we could have a whole webinar just on laminitis, so I'm going to be careful not to dive into too much here. Of course, it is if we were to think about the primary and secondary laminae like Velcro, and there's a die-off effect of that Velcro, and eventually we get a collapse of the laminae. So it's important though that we think about that there's different types, there's essentially two different types of laminitis, and they're going to need two completely different treatments. So it's important that we get a veterinarian in there for radiographs as soon as possible, and we figure out exactly what we're dealing with. We can see here on the left-hand side that the lamella is all very straight and orderly. It's not disorganized at all. And here on the right-hand side, of course, is very disorganized. So we can see the amount of disruption caused to the laminae by laminitis. So it's a very serious condition. And like I say, I would definitely recommend a veterinarian be called straight away for radiographs. Again, these are some pictures from anatomy of the equine. So when we think about the two different types of laminitis, the first one we typically think about is a rotation, and that's just where more so the dorsal area of the coffin bone pulls away from the lamellae. Of course, what can happen there is there's a major underlying artery there, the circumflex artery, and that can get crushed, which can actually affect circulation around the solar region. And so it's really important that when we do see a horse that's we think's rotated, that we treat it very seriously. Typically, horses that have only rotated are good candidates to wedge them up because the back half of the foot hasn't been disrupted too much. We can tell just by palpating the coronary band at the dorsal border, if that feels like there's a ledge between the hairline and the hoof wall, typically it would have rotated. The other thing that can happen is, of course, we can have complete failure of all the lamella, and we can get a sinking effect into the hoof capsule where P3 actually descends into the hoof capsule. And that's why it's so important. Treatment for this horse here will be completely different, and it's certainly going to take a high level of skill to get this horse back on the track. We've seen horses come through the door, and I've literally heard their feet sloshing around on the end of their limbs. Very, very difficult to manage. That does bring me to the end of my talk. I think I'm maybe slightly over time. I'd like to thank the American Farriers Journal again for having me. Also Equinox for their sponsorship, and of course Rood Riddle. They've put a lot of time into my education, so I'd like to thank them as well.
We have a few questions for Stuart. One is, are the collateral grooves static even when dealing with deep thrush in the grooves?
Generally, I think they are. I do find them as a reasonably stationary landmark. The only exception to that could be possibly sheared heels. I mean, there's always going to be an exception, but generally I will take them as a stationary landmark.
Okay. Another question is, what causes the deterioration of the exfoliating frog, and how can it be reestablished?
Well, I think a lot of that is environment-based. We need to look at, and I think this is probably very relevant to the webinar. It's the humidity, the heat, and also how much water. Those frogs are typically picking up a lot of bacteria or fungus. So it's really important. As a side note, Mike Wildenstein did a nice little study, a paper a little while back about if we are using a topical treatment on horses' feet and it's not being effective, there's a chance of either one or both bacteria or fungus sitting within one infection. So if a topical treatment's not working, you may need to take a little biopsy of that area and actually figure out exactly what level of bacterial fungus you're dealing with.
Do you find that bar shoes are generally provide proactive help in the springtime?
Sorry, could I have that question again?
Sure. The question is, do you find that bar shoes generally provide proactive help in the springtime?
It would be on a foot by foot basis. I find uh, if the wall has been under some kind of stress and it's flaring, yes, I will try to incorporate some other structures. It comes down to I'm going to be identifying the most strongest structures of that foot, and I'll load that. So a good example of this would be, let's think about a club foot. The most robust structure of the club foot is the heel region. So I know I'm a little bit off track here, but it's going to make sense soon. When we wedge a horse's foot up, the center of pressure moves back into the horse's foot, backwards, caudally in the horse's foot. So that would put more load on the heels of that club foot. So I can manipulate the pressure around in that horse's foot. So it really does come down to identifying the strongest structure and loading it. And it's a matter of being able to identify that. So if a bar shoe was going to push the load where I needed it, that's what I would use. If I thought I was looking at more solar prolapse, or I didn't think that the horse had enough sole integrity, I may use a softer equipack or something like that. So it really is a case-by-case kind of situation.
Do you have any thoughts on how to lower exposure to caustic hoof products?
As an availability of them, or I mean, it's really up to us as farriers or professionals
Yeah,
to.
we lost audio there for a second. Can you go back on that one, please?
We okay. Um, as far as lowering exposure to these caustic substances, I think that's up to us as professionals. We have a choice about what we put on horses' feet. Um, I stock products that I'm comfortable using, and I know the properties of them. So I think that's more important than anything as professionals, that it's really up to us to be educated on the products that we're using.
And when when you have a horse that you suspect has damage to the circumflex artery, what is your approach to helping with that?
Okay, so it would depend in regards to what I would do to manage any damage to the circumflex artery. Of course, it goes a little deeper than that. It would depend on whether the horse is rotating or sinking. If it was rotating, uh, I think the Nanrick Ultimate Cuffs can be a good tool to use. I would be looking to wedge that horse up and move the pressure away from that circumflex artery. By wedging the horse up, there's essentially a marriage between the deep digital flexor tendon and the circumflex artery. As pressure pulls on the deep digital flexor tendon, that does depress into the circumflex artery. So if we can limit the amount of strain on the deep digital flexor tendon, we're therefore minimizing the effects of pressure on the circumflex artery. So, I mean, the circumflex artery has a lot to do with perfusion in the sort of dorsal solar region, and also the health of the coffin bone. So we certainly do want to preserve it as much as we can.
Okay. What's the best topical to apply to an animal you may only be able to get hands on every few months, like an exotic equid?
Oh, exotic equids. That's a good question. I'd probably need a little bit more information on that. I mean, what sort of infection are we dealing with? How deep the infection goes? Um, Unfortunately, if you're not seeing any animal very often, it can be very hard to get these treatments on them. But I'd certainly be looking to put on something for one safe, and also and probably look to get a higher concentration on with foot packing that animal, and try to get a higher concentration that way and get it lasting longer. Just and basically by a different application technique.
Do you recommend any products to horse owners for topical application And do they change according to the wet or dry seasons?
Yeah, I do recommend certain products. The products that I've had a lot of success with, a lot of them that I've talked about in this webinar. Um, I really do like to set my clientele up to succeed, so whatever I do leave with them, it's going to be something that I've used a lot. Seasonally, it will change a little bit. For the wetter months, of course, I'm going to use a lot more uh, uh, Keratex hoof hardener. In the dry seasons, I kind of like Contender. That's a topical treatment that you put around the coronet band, and I think it really does help kind of soften the horse's feet a little bit, and I think that'll help dissipate some weight, energy through the horse's feet.
What type of paste would you recommend to pack for wall separations?
Um, if I thought it was only at a epidermal level, meaning it wasn't communicating with any deeper structures, I kind of like a product that does have some copper sulfate in it. I find the copper sulfate really effective. There's numerous ways to do it. Like I've mentioned in the webinar, there is the Keramine paste that does really stick well. I've also used copper sulfate to water ratio. The horse's feet, we can hijack the porous nature of horse's feet. So if we were to put a 50-50 mix of copper sulfate crystals and water together and paint that with a brush or something like that, I've found that super effective as well. I've also mixed copper sulfate crystals with Vaseline. And all these work. It really depends on which way you want to go about it. Also, make sure you keep all these products away from children. Again, that blue kind of water when copper sulfate is mixed with water can look enticing to children, so make sure it's in a safe place.
Can you explain how your trims differentiate depending on the seasons?
My trim is going to change a lot, but it also depends on a horse-by-horse nature. There's certain times that if the horse's wool is very functional and it has great solar contour and the frog's healthy, I'm going to go for a very traditional trim where I keep the exterior wool in alignment with the coffin bone. Very traditional work. There's other times I'm going to hydrate different methods, and especially if I'm gluing, I do like to kind of use a barefoot style trim sometimes and then put a direct glue on or an indirect glue on over the top of that. And I think if we were as particular with our trim as what we are shoe selection, I think the marriage of farrieing and applying shoes would nearly have it sorted out. I think with the amount of shoes on the market, and a lot of them are really, really good shoes, great mechanics in them, offering different sorts of advantages. If we could manipulate our trim and maybe as farriers be less one-dimensional about our approach and look at the foot's architecture for guidance, I think that would really help a lot. So it really is a foot by foot. I'm looking at the horse's the foot architecture and going from there, and that really will kind of help guide my trim.
Is there a household cleaner or item that you could recommend to help get rid of thrush?
No.
Do you think copper nails in shoes are a good option?
It's definitely a new product on the market. We've started to play around with them at the clinic. I think, we do see some oxidization from the nails sitting in horses' feet. You'll see those black rings around the old nail holes and that kind of thing. I think they would work well while they're in there, but if you take those nails out, you've still got a hole that we need to cover up somehow. And I've seen different topicals for blocking old nail holes, from beeswax with copper sulfate in it to numerous other products. I do like the Kevlar hoof guard after I've finished shoeing a horse, especially if it's a very aesthetically pleasing job and I've sanded it and done all these other things. Until the natural oils in the horse's feet replace themselves, I will put a topical treatment on to try and, to block those holes and make sure I'm not going to allow any more keratinophilic bacteria or funguses in there to kind of start eating away on those horses' feet before they get back under control.
Okay, and the final question that we have, there's a farrier has a case of a zebra in Florida. Is there a foot soak or product that they can use to treat white line disease and hoof wall separation that is applied infrequently?
I mean, any infrequent treatment is going to be very difficult to get on top of any kind of white line or anything like that. I'd probably be reaching out to the clean Trax for that. I've taught a lot of my clients how to use it, and they're very comfortable. I think it's a very safe product to use. So I'd probably try to look at something like that.
Okay, great. Well, thank you again, Stuart and Equilox, for this evening. Again, you can learn more about their products at equilox.com. If you missed any of this webinar or would like to rewatch it, please visit americanfarriers.com after 6 p.m. Central Time to find the video. Before we sign off, I'd like to thank each of you for attending and being a part of this webinar. I hope you enjoyed it as much as I did, and I hope you attend our next session. Whether you read the magazine, visit our website, or follow us on Facebook, we'll be sure to share that information with you. And with that, I hope you all have a great night.